Hair thinning, hair loss, and hair shedding is a part of everybody's life and it is very distressing. Today, in this video, I'm be telling you 5 important reasons of hair fall and what kind of hair loss it usually causes so that you can think about it and come and approach a doctor well in advance. The first one is called as the telogen effluvium. That is a type of hair loss which is more generalized, in which you will get clumps of hair which are falling onto the floor, bathroom sink, you'll see it on the pillow, and you will suddenly feel that so much of hair is everywhere. Now this usually happens after a illness, like if you have had an episode of typhoid, malaria, chikungunya, change of place, change of weather, change of season, you've just shifted into a new job, and long working hours. This is called as telogen effluvium. The second one is the nutritional. Now usually when we also look into blood tests of people having hair loss, we find that people have blood iron levels, ferritin levels, and vitamin D3, which is very specific to hair loss, being deficient. So, such kind of people will usually have hair thinning or hair loss, which is more of a long standing. So, few months they would have thinning and subtle hair loss over the period of time. And when we dig into the blood test, we usually find out that they are deficient and they have to be corrected appropriately. The third is called as the hormonal hair loss. Now, usually women are not supposed to have high male hormones, but in many of these hormonal imbalance cases like PCOS, you usually do have male hormones running in the body, and that may lead to a very peculiar kind of a hair thinning, which is on the center part of the scalp. Now, women usually complain, in few months or years they've seen that the partition of the hair has split, it's more visible, the scalp is more visible, and on the counterpart in men usually they see the thinning is happening here on the temporal sides and on the vertex. This is called as the pattern alopecia, and it is because of the high running male hormones in females and in men. Another hormone which is also responsible for hair fall is the thyroid. Again, one of the most commonest causes, hyperthyroid or hypothyroid. Both of them will lead to a hair loss. So if you see, the third and the most important ones will be hormonal related hair fall. So that is the pattern alopecia, could be related to thyroid or could be related to PCOS, which is like a multi-hormonal abnormality condition usually seen in young girls and women, and they will also have a typical kind of a hair thinning and a hair fall. The fourth is this anagen effluvium, we call it as. In this, usually the complete hair of the scalp gets destroyed in a very short span, and that happens when people are on anti-cancer drugs or anti-malignant drugs. Now, when the hair is in the growing phase, that is where these drugs actually completely destroy the hair bulb and the hair falls from the scalp. Reversal of such kind of hair will be there post the stopping and cessation of the anti-cancer drugs, but it may be very partial. You may have to assist with lifestyle changes and giving support to the hair and doing some treatment so that the hair gets into an active stage. So anti-cancer drugs and other medications can also lead to a complete loss of hair in clients. The fifth and the most important one are chemical based injury to the scalp. So when you are repeatedly undergoing chemical treatments, perming, blow drying, extensions, and many other which actually cause an inflammation to the scalp, can also lead to thinning, damage, and compromise of the hair shaft quality over the period of time. Or you may also see a hair fall post a coloring session if not done properly. So these are the 5 main reasons you may have sudden hair loss. And I would feel the moment you experience that the hair shedding is over the board, it's not normal, please consult a doctor so that adequate measures can be taken, blood tests can be run through so that we come to know whether you're deficient into something else like a hormone or a vitamin deficiency or iron deficiency, or your lifestyle has to be changed in the form of your coloring, hair coloring patterns, which kind of color, all can be advised at the right time. So do not wait for an entire hair fall season to happen. Please approach us much well in advance. Thank you so much.